We are here today to talk about the merger of the two bills. The bill that I had, SB 8 and SB 48, and AB 8 will be merged into a single bill. It will be the AB 8, and will be authored, the principal author, the author will be the Speaker of the Principal Co. That bill is in the Senate right now. It will be heard on the 11th of July. And you've been, I think, given a handout that sort of shows where the differences have been. About 90% of our two bills were the same. So we're moving some things, Assembly version on some, Senate versions on the other. But what we really wanted to indicate that the Democrats now in this building are united. We now have a Democratic bill that it is being led by the Speaker. He had a good track record last year with AB 32, so we don't want to create too high of an expectation, but we expect the same thing this year. So with that,
thank you very much, Senator Perata. I do believe that today's announcement of a one Democratic proposal on health care is a major milestone on the road to fixing our health care system in California. I do want to say that if you look at some of the amendments on the bill, the Senate, I think, was wise enough to have an amendment on the bill that deals with affordability for low income, and which was capped. This is in the state purchasing pool, which was capped at 5% of the total income of those poor workers. We believe that that is a great way to demonstrate our commitment to making sure that everybody gets access to health care. We also take out the requirement in the bills that everybody must be covered. We know there's a difference of opinion with the administration with respect to that, but the reason why we decided to pull that from the bill is we need more time to figure out whether or not there is an affordable health care product for the average worker in California and their families. We want to make sure that even people who make above 300% of poverty but are still middle-class families can afford at the end of the month to make a premium payment that's consistent with them being able to have a dignified life and not have to make dig 30 or 40 or 50% into their monthly budgets in order to be able to do that. And as complicated as health care reform is, I think the most important thing here today is that not only are Democrats in the Assembly and the Senate unified, but the fact that we've united around one bill, Senator Perata and I taking the lead on this bill, assures the advocates, the children's advocates, those that have been asking for health care reform, those that have been clamoring for change in a health care system that oftentimes they're lost in. I believe for them, this is an expression of faith. This is an expression of real hope and real progress. And so we look forward to moving the bills forward, moving the bill, as Senator Perata said, out of the Senate Health Committee on July the 8th, which is, I think, the last day before we break. I'm sorry? That's what I said, the 11th. Didn't I say July 11th?
second.
Oh, yeah, sorry, I said July 11th. The second thing I wanted to say is that clearly what this does is it gives us the entire summer to negotiate whatever aspects of the bill need to be negotiated with the governor, and it does give us an opportunity to reach out to our Republican colleagues to see whether or not there's any hope that this bill is something that we can sell to our Republican colleagues. And as difficult as that might sound, we're going to make that an effort. We're going to give that the effort that deserves as well. But we're going to have the whole summer to work on it, and I think we're going to need the entire legislative calendar to make sure that we put the right work into this bill, that we have the hearings, have as much public participation. The ongoing meetings have been great. The working relationship between the Senate and Assembly couldn't be better on this issue. And I just want to thank Senator Perata and his staff for being so vigilant and so committed to what I consider to be the most important issue this year. Thank you.